You for joining us for our COVID-19 update for Eau Claire County. We really appreciate the time you take to join us, and this is our time to answer media questions as well as share an update about what's happening in our community. Today is Thursday, November 12th. Again, thank you for joining our Q&A session. I do want to do a shout out to all veterans and those who serve, not only serving now, but served in the past. Yesterday was Veterans Day, so do want to make a note of that and really thank those people that have served our country. So the challenges of COVID-19 in Eau Claire County, as I'm sure many of you are not surprised to hear at this juncture, are considerable. Individuals and families in this community are challenged. Our public health team and our hospital and healthcare partners are challenged. The issues are real and they are serious. We are in a place now that we were trying to prevent being in, and we really need to get the attention of everybody in our community, to everybody lift the burden together and realize that we can do this. We can move forward with those strategies that will make a difference, but we need everybody to do that. We have entered a new phase of the pandemic. I'll talk a little bit about the data, but it's clear from the data that we are in a different space than we were even a month ago. There are lots of positive things happening. One example of that is the Caring is Contagious sign-on that has happened through the Chippewa Valley Economic Recovery Task Force and many other partners. We have many business entities, government entities, educational entities, and individuals that have signed on to the Caring is Contagious effort. We need everybody to lean in and realize that we need to do the work together to make a difference with COVID-19. We need to use our individual power, the power that we have if we work in organizations or systems, and our voice to make a difference. Each of us can protect ourselves. Each of us can protect those around us. I've heard people in this community say, just let people live their lives, let people make their own choices. I understand why that sentiment might be out there. What I need everybody to understand is that the individual choices that people are making right now are causing problems. They're not safe and they may be unsafe for others. And I need everybody to lean in and do those things that will make it safer for all of us to get through the next number of months. We'll walk through some of the basic state data like we always do. We'll walk through the Eau Claire County data and share a couple of updates, and then I'll answer a few of the questions that came in advance, and then I'll follow with any questions that the media partners have that are online with us today and answer those. We'll also at the very end, I'll have Audrey, who is working with me in another space to monitor the calls that are the chat box that comes in. I'll ask her to also give people a chance to unmute and ask questions. So our state status update, we are now at 1,946,779 negative tests for COVID-19, an increase since last week of almost 83,000 negative tests. We are now at 293,388 Wisconsin residents that have had COVID-19, an increase of 43,464 individuals since last week, Thursday. 464 people in Wisconsin have gotten COVID-19 diagnoses since last week. Today, the 12th of November, is another record-setting day for the state as a whole. Today, we saw the single highest confirmed case count in the state at 7,497 cases today. Of people that have had COVID-19, 13,771 individuals in Wisconsin have been hospitalized. That's an increase of 1,461 people in Wisconsin that have been hospitalized since last week, Thursday. We now have 2,515 of our family, friends, and neighbors in Wisconsin that have died of COVID-19, an increase of 321 residents that have died. As of yesterday, Pepin County, a neighboring county, had their first death, and now all 72 counties across the state have had deaths related to COVID-19. We've set records in Wisconsin this week for cases, for deaths, and for hospitalizations in a single day. None of them are records that we wanted to set and continue to set. Today was the top day for cases, as I said earlier. On the 10th of November, we had the largest single day for deaths. 66 people were reported to have died related to COVID-19 that day. And also on the 10th, we had 291 people hospitalized. The state 7-day average positivity rate, so those percent positive people by tests, one person tested multiple times as counted once, is at 36.5%, almost 36.5%, 36.4%, the highest ever. Wisconsin right now is seeing more cases per day on average than New York City did at the peak of their surge in April. Wisconsin is a smaller population than New York. The positivity rate by test, all negative tests by one person, that by a single person that is counted, is at 18.9% at the state level, the highest ever as of yesterday. Our local rate, our positivity rate, is even higher, which I will share shortly. In Eau Claire, our basic data for you. Our negative test numbers are now at 33,491 negative tests for COVID-19. We now have 5,475 individuals in Eau Claire County that have tested positive for COVID-19, an increase of 919 since last week, Thursday, when we spoke last. Our positivity rate by test is 19.7, again, higher than the state positivity rate. We have 3,969 individuals that have completed their isolation and are considered recovered from COVID-19, but a remaining more than 1,200 people in Eau Claire that are currently isolating for COVID-19. We have, of those people that have gotten a positive diagnosis of COVID-19, 173 have been hospitalized, an increase of 22 individuals, Eau Claire County residents, since last week, Thursday. Hospitalizations in this region continue to increase every day for people that are COVID positive. We now have 34 individuals that have died of COVID-19 in our county, an increase of 6 people since last week. A couple of other data points that are available on the state website, public health investigations. Currently, we are listing on the state website that we have 63 active investigations across all sectors in our community, including long-term care facilities, work sites, educational facilities, and healthcare settings. The state rating for COVID-19 activity in Eau Claire County is actually now at a new level. The state this week added a critically high level, which is 3 times greater than the very high level that they were previously reporting. Eau Claire County is at that critically high level, as is most of the counties in the state, unfortunately. That critically high level means that over 1,000 cases in 2 weeks for a community of our size have been reported. We have had more than 50% of all of our total cases happen in the last 4 weeks. It's something that we should be noting. Our trajectory is going up rapidly, and it's something that we need to flatten out. As of Monday, November 9th, 15% of all of our cases since the 1st of September are affiliated with UW Eau Claire. We also know that all of our cases across the community are really spread out in all age groups and in all jurisdictions. We are seeing rapid growth of COVID-19 cases in areas outside of the city of Eau Claire, where we were seeing initially the most rapid growth in cases. The 7-day average this past week has been 140 cases per day. Our goal is around 10. You've heard me say that before. It's considered to be a lot of cases if we are over 35 cases a day, and we are well over that number. We've exceeded that very high level since the beginning of September, and now we're at that critically high level. A couple of other data points for you to be aware of. Among Eau Claire County residents, nearly 55% of the confirmed cases of COVID-19, 50% of the hospitalizations, and more than 77% of the deaths have occurred in the last 30 days. Again, that's indicative of the numbers really rapidly increasing in this community. It's happened all over this region and is certainly happening across the state. The death rate for Eau Claire County has been more than 50% higher than even the Wisconsin average in the past 30 days. Again, the per test positivity rate, again, that rolling rate, is 113% higher than it was 30 days ago. Again, giving you those data points to share that things have changed rapidly and we need to slow things down. Again, similar to what I said last week, we are not powerless. We know that this disease spreads when we come in close contact with one another, when we don't wear a cloth face covering. We need to know that if we keep our groups small, if we keep 6 feet distance, and if we wear a cloth face covering, it'll make all the difference in the world. We know that many institutional partners and individuals are doing that. We need to all do that. We need to lean in hard now to do that, to make a difference. A couple of other data points that we talk about weekly, and that's our jail testing data. A total of 230 individuals have been tested connected to the Eau Claire County Jail. There are 18 positive cases that have happened, with 15 recovered, 3 current cases of COVID-19. A couple of announcements. One, more generally related to health, is that the open enrollment period, the period where individuals can sign up for health insurance through the federal government, the healthcare gov location, it started on November 1st. It ends on December 15th. For those people that need to access that resource to sign up for healthcare, please do that. We need people to be covered by healthcare insurance, and we really encourage people to take advantage of that opportunity. More information is available at 211 about this, as well as at wiscovered.com. It's also Medicare open enrollment. Again, we encourage people that need that resource to take advantage of that open enrollment period. Again, open enrollment information is widely available, but the Aging and Disability Resource Center in Eau Claire County is an amazingly helpful resource locally to get your questions answered. The ADRC phone number is 715-839-4735. This week, the governor did have a new executive order that came out. That order is an advisory statewide to really go back to the frame of being safer at home. We are in a place now well beyond where we thought we would ever be last April, where we really have case numbers and hospitalization rates far exceeding anything that we were hoping to have. Tuesday, Governor Evers stated that we are in an emergency again, and that emergencies take drastic and collective action. He issued an advisory to be safer at home. Don't travel outside your home except for essentials. When you go out, wear a mask and keep your distance. Again, do those things that will help support your well-being. Get online or on the phone with your loved ones, give emotional and social support to those around us. Get some physical activity. You can get outside and do that and still keep distance. Employers should work hard to stagger shifts to make sure distance is maintained and make sure that face coverings are worn. We'll be updating our local expectations document with many of the similar premises. Really, we're at a point now that we need to have clear expectations for everybody that we need to do our part to slow spread of disease. State data updates are also available. Yesterday afternoon on Wednesday, the state rolled out a number of new updates on their dashboard for county level data. Please look there for more information, but they are now reporting probable cases for COVID-19 as well as case numbers for those PCR tests. Probable cases are those that were tested via an antigen test and may or may not have had a confirmatory test done. There's also cumulative deaths among other measures. As we have more antigen testing happening in our community, and I'll talk about that in a minute, we will have likely more probable cases reported for Eau Claire County, so do know that. When we give you our case counts, they will be the positive cases without those probables, but do know that probable cases very often are ones that need to follow the exact same isolation requirements and quarantine requirements. So they are people that need to make sure that they are following the instruction of the testing site where they get that antigen test and really make sure that they are not spreading disease. Antigen testing did start increasing in Eau Claire County with the new initiative. On Wednesday, the University of Wisconsin-Eau Claire announced a new testing strategy that is being given to UW system campuses across Wisconsin directly from the Department of Health and Human Services at the federal level. It's being implemented in a partnership. It's a federal surge testing asset, the idea being that we are in a tough spot in Wisconsin, and the goal of the next 4 to 6 weeks of testing is to really get a good sense of how prevalent the spread of COVID-19 is in our state, and looking especially at asymptomatic individuals that may be positive and unknowingly spreading COVID-19. The focus of this antigen testing effort is UW students, faculty, and staff, as well as the community. The initiative will bring about 14,000 antigen tests to our community. The on-campus location for UW faculty, staff, and students did begin already last week. The new community testing location will start this Saturday at Memorial High School. The testing hours will be Saturday, Sundays, and Wednesdays from noon until 8. We are encouraging asymptomatic individuals that may be concerned about being in close contact with people because of your employment situation or because of other reasons. People that are asymptomatic and worried about spread, we're encouraging them to be screened at this location for the potential of being someone that has COVID-19 and not aware of it. Anybody that is tested at this location and that tests positive as an individual that is asymptomatic will immediately get a follow-up PCR test. That PCR test is the gold standard to really tell us if that individual really has COVID-19. Again, the testing site, this community testing site, is best suited for people over the age of 5 who do not currently have COVID-19 symptoms. Those people that attend, live, or work in a group setting. Examples of this might be schools, daycares, shelters, group homes, individuals that are working in close proximity with others. The benefit of antigen testing is that you get a quick result, but in some situations, again, confirmation is necessary. So it's important that people understand the tests they're getting and then follow the instructions that they get at that testing location. It's also important to know that testing is not a magic wand. It's not a solution to slowing the spread. It's just one of the tools in the toolbox, only one of the pieces of the full puzzle. We can't test our way out of COVID-19, but if people do get tested and they are identified as a positive, they can quickly do the required isolation and notification of their close contacts, and in that way slow spread to the next circle of individuals. So testing is critically important, but so are all of the other strategies that are critically important as well. Isolation and quarantining being also very important. Every week, we also talk about our measures. These are the measures that we report weekly to watch over time what's happening in this community. No surprise to anybody listening to what I've said previously is that those measures look concerning this week. Again, we've heard also difficult reports from our healthcare partners this week about their challenges, and that's been widely available information across this community, and our measures also reflect that. Again, our inpatient hospital beds are concerning. Our ICU beds in the past 14 days in the Northwest region are in the red. We know that every day we see increasing counts of COVID positive individuals hospitalized. The hospitals have made a plea across the region to really slow the spread. They need space for not only treating individuals that are COVID positive that need hospitalization, but they also need space for all of the other things that they do that are critically important in our communities to help support our health. We need to keep them open, and we need to support them in staying open to all of us that may need them for other reasons. Again, if you have a healthcare emergency, go to the hospital. Their message is not that they don't want you to come. We need you to go to the hospital if you are having other healthcare emergencies, but we also need to all work together to slow spread. Other metrics that are available on our dashboard include an increase. We're in the red for the number of new outbreaks that we have at 24. Our community spread remains in the red. Our follow-up for cases remains in the red. We right now are following up. Our team is working desperately hard to follow up on the 100+ cases a day that we are getting, but we are not getting to all of them. We are right now having to prioritize even the cases that we follow up with. We are asking people to, when they are notified of a positive test result from a testing location, to isolate, to go to our website if they need more information about what that means and for how long they need to do that. But that does mean stay home if you have been identified as having a case of COVID-19. There's really good information on our website, and we need you to be in touch with your close contacts. So those people that were in close contact with you within 6 feet for more than 15 minutes or that live in your household are considered close contacts. They need to stay home for 14 days. That's the quarantine requirement. There's really good information on the website. We are doing our best reaching all of those cases, but do know that we are challenged with that. The more cases we have, the harder it is to do that basic public health work. And we are also pleading with you to decrease the number of cases so we can do a good job slowing the spread. We also want to make sure that you know that as we are moving forward, those measures we are slowly changing. So we will be, you'll see on our site that we are now not actively tracking our close contact follow-up because really we are not able to follow up with close contacts. Those close contacts in many work situations, so in schools, at UW-Eau Claire, at CVTC, those close contacts are being notified. Close contacts are also being notified by cases. So if you are told you are a close contact, listen and quarantine for 14 days. If there are individuals with questions, we certainly also welcome people to call our COVID hotline. That number continues to be 715-831-7425. Again, I would finally say that we are anticipating tomorrow to update our community expectations document. We will share that broadly with the media when that comes out. We will also have it posted on our website. That community expectations document, like you all know, lays out individual expectations as well as expectations for public spaces and for gatherings, both public and private gatherings. We are really moving forward, similar to what has happened with the state, to say that, again, individually, we need to keep distance and keep our circle really just with our most immediate, close household contacts and immediate family. But in public spaces, we need to keep occupancy at 50% and keep all of those basic requirements in place. And in public and private gatherings, so those things where we gather for social reasons, that we are doing it with no more than 10 people beyond our household. We need people to lean in hard, and we need really for everybody to make those choices to make it safer for everybody around us. It's not just about us, it's about everybody that we may potentially come in contact with. I'll now go through some of the questions from the media that we got in advance, and then we'll open it up to some of the questions that may be coming in via chat or that people want to unmute and share. First of all, the question from the media is about field hospital. I know we addressed this a bit last week, but I'll again share with you a bit about what's going on with having alternate locations beyond our set hospital locations for caring for individuals with COVID-19. We continue to have access to the COVID-19 field hospital or alternate care site that is available in Milwaukee. That site continues to run. It is a resource that can be used by those in our community and will be used when it is appropriate. We are also pushing the state hard right now in the last couple of days to make that site available for individuals that may need a level of care that's slightly above what they are currently providing. We are hoping to support hospitals in being able to discharge COVID positive individuals to an alternate site, that site being in Milwaukee, if they need care that is less than what a hospital needs to provide, but a bit more than what a skilled nursing facility has available to them. So we're working through that. We also continue to work with our healthcare institutions to identify ways to support them triaging individuals and making sure that they have the resources that they need to serve the individuals there. Again, not different than what we started to say to everybody back in April. We were hoping to prevent this. We are counting on all of you to not continue to increase the positive cases of COVID-19 and the spread to populations where hospitalization may be necessary. We are seeing hospitalized individuals at all age groups. This is not just people that are over the age of 65 or with considerable underlying conditions. Anybody can be hospitalized and have significant issues with COVID-19. Every day we see more news reports of the long-standing issues that individuals may have after a COVID-19 diagnosis, even if they never were hospitalized. We need to pay attention. This is not the common cold. This is not influenza. This is something significantly different. We also got a number of questions related to the holidays, particularly the Thanksgiving holiday. Some people in this part of the state and all of Wisconsin might see deer hunting as the holiday also coming up. And questions related from the media about travel, about gathering, about what to do in advance of those holidays and after those holidays. There is Thanksgiving-related holiday information on our website. Centers for Disease Control, the State Health Department, and our health department are all asking people to celebrate holidays differently. While it's difficult, and it's difficult for me and my family, we're asking people to say it's more important that we protect those we love. It's more important to keep our circle very small and just have it be immediate family and those people that we live with, that we are gathering with. Do things differently this Thanksgiving with your family. We need to do that for one another. Ideally, stay home, don't travel. Celebrate with those you live with and your very closest connected immediate family. If you see others, keep those numbers to be as small as possible. Again, our public health expectation document is 10 or fewer. If you go out in public, wear a mask. All of those basics, again, need to be adhered to. If you do decide to travel, again, not a recommendation, consider laying low before you go. That's a phrase that we're hearing across the nation, but if you are choosing to leave your home to travel, make sure you're protecting others by quarantining yourself for the 14 days before you travel to make sure that you don't have inadvertent exposures to others that make you at risk to be someone that perhaps has COVID-19 and not be symptomatic. Same thing when you return. If you decide to travel, consider ways that you can stay home for 14 days after you travel. A negative test at some point before you travel or a negative test at some point after you travel is not a guarantee that you don't have COVID-19. Don't see that as a ticket to go visit grandma. A negative test is really one point in time. It's not a bad thing to do, but it is not a sufficient thing to do to protect people around you. Don't go and visit people that are higher risk. If you see anybody, if you do visit, make sure that you are more than 6 feet apart and have a cloth face covering on. Don't gather in a large group. My Thanksgiving will be significantly different this year. All of ours will be, I hope. We can do this together. We can find creative ways to connect, maybe come up with some fun and unusual traditions that we can tell stories about in the years ahead. It isn't easy, but I know we can do it. We need to support the success of our community both right now and in the weeks after Thanksgiving, deer hunting, and the winter holidays happen. So I will ask Audrey, do we have any additional questions that you're aware of?
We don't have questions in the chat box, so if there's any media who are on the call and would like to unmute and ask, please feel free to go ahead.
Does anybody have any additional questions for us today? All right, my heartfelt thanks. One of the things I'm trying to practice in these days when it's been so difficult is to have that little mindfulness exercise about really noting something I'm thankful for. And actually, for me, it makes a difference. We did it with our management team before our management meeting this week, and I would encourage all of you to do that. But I am particularly thankful for people in this community that are showing their caring by the actions that they're taking. It does make a difference. I do see that. It is noticed. Please also continue to do those things. Please make sure that you are showing your appreciation for the businesses, for the partners that are doing the right thing around making sure that 6 feet is maintained, make sure that occupancy levels are lower, making sure that face masks are worn. Thank those decision makers, those leaders that are doing those things. They're not always easy. And when you thank them, it reinforces that they're doing things that are making a difference in the community and that you're noticing. So please find a way to thank those leadership people across the community, wherever they may be, whether it's a small business owner, a principal in a school, or anybody else. Find ways to thank them for the work that they're doing to try and keep our community safe. Again, thank you, and we look forward to talking to you next week.